Hi, my name is Hayden Vaughn. We're going to be inserting an IV into our patient today. We're going to check our physician's order for IV infusion. Next step is to gather our supplies, which I have over here already. Next, we're going to verbally identify our patient using the two identifiers, name and date of birth. So I'll ask the patient what their name and date of birth is, then I'll scan their ID band and confirm that over into the computer system. Next, we're going to introduce ourselves. So, hi, my name is Hayden, and we're going to be inserting an IV into you today. Is that okay? Patient will respond with yes. We're going to ask them if they have any allergies, especially to iodine, chlorhexidine, latex, or tape. Patient responds no to this. We're going to assess their extremities for the appropriate placement of IV. We're going to assess the client's previous interactions with an IV. So we'll ask the patient if they've had an IV before. Patient responds to yes. Next, we're going to perform hand hygiene to start our venipuncture process. Then we're going to go and don our goggles. We're going to apply our tourniquet 4 to 6 inches above the insertion site. Going to check for radial pulse. Radial pulse is present. We're going to be using the median vein of the left arm. So we're going to take our tourniquet off, and then we're going to start our venipuncture process. I'm going to don my gloves here. We're going to get our tegaderm, write our initials, the date, the time, and the gauge of the needle, which is 20. We're going to grab our J-loop and prime our J-loop right here. Just prime. There's no bubbles present in the J-loop. Now we're going to grab our actual needle and take the cap off and ensure the ease of the catheter movement. Put the cap back on it. And we're going to apply our tourniquet back on to the patient. Just to be safe, we're going to use our alcohol swab. Again, 30 seconds, let it air dry. And now we're going to insert the needle. So we're going to use our finger, pressure down here, and bevel up 5 to 10 degrees. All right. And we get our blood that comes back into the chamber, the flashback chamber. We're going to advance a few millimeters in. Now we're going to occlude the vein and take the needle out as we're pressing this in. So now we're going to release our tourniquet, grab our J-loop over here, take the tip of this cap off, insert it. Now we're going to flush with 2 to 3 cc's of normal saline. Okay. Now we're going to grab our tegaderm. Put it over the site. We're going to grab our tape over here and secure the tubing. We're going to take our gloves off. We're going to discard our needle into the sharps container and anything with blood on it into a biohazard bag, and then we will document if the patient had any, if they did or didn't have any complications, and that's it.